This week in the Science and Environmental Wrap. Oceans could add 1 million jobs according to President Zuma. And China sends Ebola drug to Africa. A Chinese drug maker with military ties has sent an experimental Ebola drug to Africa for use by Chinese aid workers and is planning clinical trials there to combat a deadly outbreak of the disease. An Ebola outbreak in West Africa, the worst on record, has killed more than 4,000 people. Governments and drug makers around the globe have been racing to find a treatment for the outbreak, which has spread as far as the United States and Europe. Recently, healthcare workers have been contracting the virus even with their protective gears on. Moving on, the health department has discovered that 7,000 grade 1 learners in South African schools have tuberculosis. The department ran a school health program and assessed 280,000 grade 1 learners across the country. The assessment also revealed that at least 90,000 of those learners have eyesight, hearing, and speech problems. South African oceans may serve as more than just vacation spots. A solution for the high unemployment rate in South Africa may come from the country's seawater. This is according to President Jacob Zuma, who announced that oceans have the potential to create 1 million jobs and contribute 177 billion rand to the country's GDP by 2033. A number of opportunities were highlighted, ranging from shipbuilding to aquaculture and oil and natural gas exploration. He said it was a concern that the country did not have any merchant vessels flying the South African flags. Staying with oceans, the Dugong, a dolphin-like mammal, is disappearing from our oceans at a rapid rate, with only 250 left off the east coast of Africa. The myth of the mermaid stems from the Dugong, but with its ever-decreasing numbers, it seems as though it too will be a myth soon. Monitoring the situation is Endangered Wildlife Trust, a South African-based NGO.
Globally, the populations have taken a knock, and this is mainly due to illegal fishing activities. The dugongs get entangled in illegal nets, in gill nets mostly, and what happens is they aren't able to reach the surface every 6 or 7 minutes to take a breath of air, and essentially they land up drowning in these gill nets.
And finally, KwaZulu-Natal's Hluhluwe-iMfolozi Park has received its first contraceptive vaccine to prevent elephant overpopulation. The Humane Society International and SABC KZN Wildlife says the contraceptive program allows elephant populations to be managed humanely to slow their growth rates and to maintain the ecosystem. The program is being funded by SABC, HSI, and the United States Fish and Wildlife Service through the African Elephant Conservation Fund.